Yes, checking on your fallopian tube is good because there's a lot of things that are going to check there. Not only that, if your fallopian tube are blocked, they're going to check if it has leakage. Okay, hi guys, welcome to Cooking with Gina's. Yeah, today I want to share this with you guys. I just finished my exercise this morning, and I think like staying in this garden, making my video because the view is very nice. I'm going to show you later. So today's topic is what you need to do if you are trying to conceive and you find it so hard to conceive. The first thing you need to do, in fact, don't stress yourself too much googling because is it can make you go mad sometimes. So let's dive into the matter. So the first thing you need to do with your spouse is you have to book an appointment with a doctor, with your gynecologist, and make a meetup with him or her. Here in Germany, you have to book an appointment and they're going to give you the date you're supposed to be there, meet with your gynecologist before anything. You can't just walk to the hospital and start explaining your problems and all that. No, you need to book an appointment, meet with your doctor, talk with him or her. They are going to check on you, check on your spouse. If your gynecologist are not the one to take care of your spouse, they're going to refer him to a place that he has to go and check himself. And they're going to check everything, check your womb and know if your womb is okay, and before the next thing they are going to do on you. So in case your doctor forgot to tell you this, just remember this to your doctor. That's the second tip there. Remember to tell doctor that they need to check your fallopian tubes. Okay, but I know they are going to tell you on that, and like here in Germany, doctors, they ask questions. I don't know about Nigerian doctors or other African doctors, but here they're going to ask you about your past. So get ready to explain to your doctor your past. If you have already conceived during your youth age or when you are not married, have this in your mind when you're going to meet your gynecologist. So they're going to ask you these questions. Okay, so my next video I'm going to tell you what to expect that your gynecologist is going to ask you when you are trying to conceive. So the question she or he can throw to you and you are willing to answer, because that's the way they're going to know what they're going to do on you. They are not the one to check on your fallopian tube, but they are the one to refer you to general hospital where you are going to undergo the checkup, either by surgery from your valve or they are going to do from under. Okay, so expect that if you find it like a year, 2 3 years that you can't conceive, you have to check on all this. Okay, yes, checking on your fallopian tube is good because there's a lot of things that are going to check there. Not only that, if your fallopian tube are blocked, they're going to check if it has leakage. Okay, they're going to check on that. Well, we're going to talk about the fallopian tube later, but that's what they're going to check there. If your fallopian tubes are leaking, they're going to seal it up so that when your spouse semen go through it, it will not leak. So that's another thing that disturbs women. So we're going to discuss about so many things that disturbs women not to get pregnant, but you are healthy and all that. So let's go to the number 3. Another thing you need to check is whether your cervical mucus is healthy. you know, checking up on that. You can check on Google, or you can explain to your doctor how you see your cervical mucus and how it comes out, how thick, how sleepy it is. You need to explain to your gyno, so from there he can know supplement that can help you to boost it for it to be okay. Sometimes it's not fertile. Okay. Another thing that you're going to check is whether you are stressing a lot. Stress. Stress can drop your hormone. You know, your hormone will go down. So a lot of stress. Check your environment. Check inner circle of yourself. Check what is stressing you down, what is making you not to be happy. Anything that is so toxic on you, on your body, try to remove it. Try to remove yourself from the place. you know if the environment is not conducive for you, have to change from that environment to another place that is okay. You have to reduce stress is another thing that is hindering us not to get pregnant. Okay, check, reduce, take it away, list it out, and you can make a list of things that is stressing you up. Remove those ones that is not necessary. There's one that you cannot even, but try to help yourself and reduce. Another thing is, for us here in diaspora, another thing that affects us so much is vitamin D. You have to check. If you did not check from your doctor, go to a pharmacist. Here we call it apotheca. You can go there. They have what the place you can check your blood pressure. You can check your vitamin D there, because vitamin D can hinder pregnancy. You will see yourself, you're healthy, you are ovulating, everything is doing on your body, you are so fine, but vitamin D deficiency can stop it. So guys, try to go and check yourself, before any other thing. And when you check all these things, and okay, my vitamin D is okay, my fallopian tube is okay, everything is okay on your body, guys, then just that you are fine. Ehen. At least that part of anxiety is out of from your side. Then the next step you can do is what doctors direct you, vitamins that you can be taking, and what you can engage your life, so that you cannot be thinking a lot about kids and all that, because from there you develop high BP if you don't know. So you go and check your vitamin D and know if it's okay. But if your vitamin D is low, you have to get vitamin D supplement and start taking it, because of weather here. Weather is another thing that is disturbing us very well. Then another thing is our chart. Some people find it hard to know their cycle, to check when they are ovulating, when they need to meet with their spouse and all that. Some people don't know it, so you have to learn. You have to try. You can Google. It's on the Google. You can Google, or you can ask somebody that you know that has a lot of experience about that. The person can share it with you, or you share with your friends that you know that they know everything about this. If you're finding, because some people, you will see them, they're big girls, but they're finding this hard to know. And for this ovulation time, you can't predict. Yeah, we know this day is the day we are expecting it, but sometimes it changes. Okay, so but try to get your um ovulation kits and check yourself, monitor your body first. Monitor and know that okay, this thing is coming the accurate time. It doesn't change. Like, check it like 2 months, and you will see it happens the same time. Then you will know, okay, this thing is okay. My ovulation is okay. Is I'm getting the results very well. So at least you know that side is done. Then you face to other ones that I talked about. So check on all this and you will know where you have problem and start solving it. Okay, don't just sit at home and okay, I'm waiting on God. You help yourself before God intervene, because God will see that you're working hard and he will come there and rescue us. These are the things you need to check. Okay, do if you're finding it hard to conceive, if you stayed longer to conceive, you have to check upon this and before knowing the next step to take, because when you look at all this and you are okay or you have faults there, then you're going to treat on that, and if you are good, then you know you know we have to wait on God time. Okay, that's all I have for you today. Just the first thing that you're going to check before thinking of another level to go on your body. Okay, so thank you for watching.